Vaccine hesitancy, a global crisis. Many parents are opting out of vaccinating their children, claiming non-medical or ethical exemptions, causing a rise in preventable communicable diseases. Obtaining an exemption is convenient and easy. In many states, it is simpler and less time-consuming to obtain this exemption than to take their child in for an appointment for immunizations. In 2019, the World Health Organization listed the reluctance or refusal to vaccinate as one of the top 10 threats to global health. Some of the reasons they have found for vaccine hesitancy include complacency, inconvenience in accessing vaccines, and patients' lack of confidence with healthcare systems. There are concerns about the safety of multiple vaccines that are currently available and recommended. The main concerns with the safety of these vaccines are not supported by the evidence. Some of the erroneous perceptions are listed on this slide. Andrew Wakefield and his colleagues published a case series in the United Kingdom suggesting the MMR vaccine would predispose children to developmental delays and regression. The study design had a sample size of 12 subjects, an uncontrolled design, and speculative conclusions. Almost immediately, MMR vaccination rates began to drop all across the world. It was later discovered that Wakefield had been funded by lawyers who were engaged in suits against vaccine-producing companies. The article was retracted in 2010 as it was found that the ethical clearance was not obtained, the sample subjects had been selected, and Wakefield and colleagues were found to pick and choose data that favored their study. Despite all of these violations, parents across the world are concerned about the correlation between autism and the MMR vaccine, dropping vaccination rates to an all-time low. Direct cost of not vaccinating for a preventable communicable disease include cost of medical treatments and other associated medical complications. Non-medical costs would include the cost of travel or special needs for a disabled child, including education and supplies. The CDC estimates that vaccinations will prevent an estimated 322 million illnesses and 732,000 deaths. One report found that vaccines prevented 1 to 2 million illnesses per year. Net savings would include $295 billion in direct costs and $1.38 trillion in societal costs, which brings us to indirect costs. Indirect costs of not vaccinating would include lost time and wages at work by either the parent or the patient, permanent long-term disability, and premature death. It is important to consider the financial impact related to vaccines. Every dollar spent is estimated to save over $10 in illness costs. According to the most recent statistics, it costs nearly $1,900 to fully vaccinate a child. Federal funds cover 95% of the costs, and state funds supplement the remainder. There are still numerous problems as far as access to immunizations. Limited health insurance still exists for some. On top of that, at some pharmacies, insurance will not cover the cost of vaccines as pharmacists are not recognized as an in-network provider. Statistics show that children who have Medicaid have a lower rate of vaccination even though it is a covered service. The uninsured have the lowest vaccination rates. Many families are eligible for vaccine programs but are not aware they exist. Also, many providers do not document that the vaccine was administered in the immunization registry for the state or region. This causes other issues including lack of documentation and possible duplication of vaccine administration. Other barriers include language barriers, lack of trust in healthcare providers, transportation problems, and inconvenient office hours. There are multiple unintended and potential outcomes that have resulted or will result concerning the issue of opting out of vaccinating children, including increased preventable communicable disease outbreaks, decreased utility of vaccines, and the potential to hold parents of unvaccinated children liable for those who become infected, including financial penalties or wrongful death lawsuits. Groups of individuals most likely affected by the unintended outcomes include newborn infants, children and teenagers, college-age young adults, and the immunocompromised. Other institutions are trying to tackle this global issue. The World Health Organization has numerous immunization policies and strategies in place to tackle vaccine hesitancy. A national advisory committee consists of multidisciplinary groups who provide independent, evidence-based advice to policymakers in countries all over the world in regards to immunization policies. They have tailored immunization programs which provide methods and tools to identify populations that may be susceptible to disease preventable by vaccines. These programs also identify barriers to vaccination that are specific to a population and recommend evidence-based responses to increase and maintain vaccination rates. In response to the vaccine hesitancy crisis, they develop survey questions to understand the underlying reasons behind vaccine hesitancy. The bottom line is that we need to understand the reasons behind hesitancy in order to develop effective interventions. It is important to understand that federal recommendations for vaccines are different than state laws for vaccines. The CDC makes the national vaccine recommendations for adults and children, whereas the public health officials in each state decide which vaccines are required and enforce these requirements. This complicates issues as each state has the individual burden of addressing and funding the issue of vaccine hesitancy. This often creates the discrepancy between the federal recommendations and the requirements of each state. State laws vary in terms of exemptions for school children receiving vaccines. In 1993, the Vaccines for Children program was created by the Omnibus Budget Reconciliation Act, making approximately 50% of children under the age of 19 eligible for free vaccinations. Utilization of pharmacists to administer vaccines followed shortly after. More than 320,000 pharmacists have been trained to administer vaccines in all 50 states. Many rural areas where healthcare providers were scarce now have access to a local pharmacy for their children's immunizations. In 2010, the Affordable Care Act eliminated many payments for recommended vaccines and minimized financial barriers. Here's what some of our own representatives are saying. Senator Warren advocates to increase access to immunizations. Representative Zedler has spoken against mandatory vaccination. Senator Giesel has sponsored a bill to renew a program to monitor and distribute vaccines to adults and children. Federally, immunizations have been a condition of school entry for over 150 years. A landmark case in 1905 supported the state's authority to make vaccines compulsory. In 1922, the Supreme Court also upheld the school's right to exclude an unvaccinated girl. Just this year, the safety and efficacy of vaccines was reaffirmed during a Senate hearing. At the state level, the Affordable Care Act requires all insurances to provide coverage at no cost for preventable services. There are many new laws being proposed across the United States. This slide highlights just a few. One proposed legislative act in particular would require Oregon residents to watch a vaccine education module and require a signature from a provider for vaccine exemption. Oregon's Public Health Division is funding initiatives to improve vaccination rates in the state for residents of all ages. Key stakeholders for this issue include pro- and anti-vaccine organizations, organizations that represent individual rights and freedoms, scientific evidence-based disciplines, and those with a public health focus. Successful efforts to gain support and influence require funding. There are many ways that funding helps, through paid lobbyists, organized grassroots lobbying efforts, and research that provides scientific evidence. There are multiple funding sources. The scientific disciplines such as nursing, medicine, and pharmacy are most often pro-vaccine, with a scientific evidence-based platform. Groups who are anti-vaccine, based on religious and philosophical reasons, often use individual rights and freedoms to lobby against mandatory requirements. Everny and Kaplan highlight the influential power of social media with the anti-vaccine group of Voice for Choice. The article addresses the influential lobbying efforts of the organization and growing support gained through outreach such as social media. The organization's website details growing support and supports claims about dangers of vaccinations that have been proven inaccurate through rigorous research, but does not prevent the potential serious outcomes of not vaccinating. Organized anti-vaccine groups are strong opposers to mandatory vaccine laws. A Voice for Choice is not a group exclusively focused on vaccine laws, but has a segment of the organization that focuses on vaccine legislation and a paid lobbyist. Their media presence has increased grassroots lobbying efforts through spreading their word through the community and social media. The platform is based on individual rights and freedoms to choose what is put into their body. The Immunization Coalition is composed of multiple organizations within several disciplines to provide educational and scientific-based references in support of vaccinations. The CDC is a part of the Immunization Coalition and provides financial support. The American Nurses Association is in the coalition. However, the American Association of Nurse Practitioners is not. They have a paid lobbyist, a political action committee, and a strong campaign influencing providers and community on pro-vaccine. The American Association of Nurse Practitioners is a supporter of pro-vaccine legislation and fights against bills that limits mandatory requirements, and they participate in an international campaign for immunizations around the world. Pharmaceutical manufacturers are key stakeholders with significant financial resources and influence, and the anti-vaccine movement stems from suspicion of the financial influence the pharmaceutical industry has on mandatory immunization legislation. A study looking at the influence of Merck & Company on legislation for the HPV vaccine indicated that there was a potential risk for conflict. In the following slides, we will list many of the questions that stakeholders may ask. Will the vaccine cause autism, shingles later in life, or get them sick? What are chemicals in the vaccinations? Why vaccinate against eradicated diseases? Is there enough staff to fulfill the bill mandates in clinics and hospitals? Are there enough resources to accommodate the mandates in the bill? Will research data be transparent and accessible? What funding is available to educational organizations? What are the costs for the vaccines, for the organizations, for the insurance, for the legislative efforts? Who tracks vaccines? Who benefits from this bill if it becomes law? There are many recommendations concerning vaccinations. Parental concerns should be addressed directly with only facts. All vaccines have been thoroughly tested. Vaccines are continually monitored for safety even after approved for use. People have opposed vaccines since the 1800s. Herd immunity is compromised with vaccine exemptions. When there is a current outbreak of a disease, vaccines tend to be more accepted. Then once the incidence of the disease has decreased, hesitancy increases. Testings for alterations to the current recommended schedule has not been tested. Further recommendations include surveillance of areas with low vaccine compliance, supply free vaccine to those in need, educate healthcare providers on how best to address parental concerns, and standardize vaccine exemptions across the nation. In conclusion, many parents are opting out of vaccinating their children, claiming non-medical or ethical exemptions, causing a rise in preventable communicable diseases. There are a multitude of factors that influence why children are not vaccinated as recommended. Parental concerns can be addressed with facts. There are multiple legislative efforts to address this issue. It is important to consider all stakeholders and the possible areas that are impacted.